I'm discussing gastroesophageal reflux disease. Gastroesophageal reflux disease. We know that gastroesophageal reflux disease is a very common. Well, maybe not everyone knows that, but gastroesophageal reflux is actually one very, very common disease condition affecting not just adults but also children, including infants and neonates. And so it's important to know the presentation, the symptoms and signs, the way you investigate or find out what it is, or be able to make diagnosis and then be able to treat the gastroesophageal reflux disease. So gastroesophageal reflux disease is basically a reflux or passage of gastric content from the stomach into the esophagus. So there's literally a retrograde passage of stomach contents into the esophagus. The reflux may not contain acid. It may not contain acid. In fact, most of the times it's actually neutral or alkaline in nature. So the fact that we say gastroesophageal reflux and the stomach contains acid doesn't have to be acidic. The refluxate doesn't have to be acidic. Most of the time it's actually neutral or alkaline in nature. So basically when there's a reflux from the stomach into the esophagus, at times it may go further than that, and this is where it gets interesting. The one that refluxes from the stomach into the esophagus is a typical gastroesophageal reflux disease, but there are atypical forms of gastroesophageal reflux disease. This include reflux of gastric contents into the pharynx. Reflux of gastric contents can occur into the pharynx, either the nasopharyngeal, oropharyngeal, or hypopharyngeal, as the case may be. By pharynx I mean into the throat. The upper part of the throat is the nasopharynx, so gastric content can actually get into the nasopharynx. Gastric content can get into the oropharynx, which is the middle part of the pharynx. And gastric content can also get into the hypopharynx, which is the lower aspect of the throat. Secondly, the second type of atypical gastroesophageal reflux disease is gastrolaryngeal. In this case, gastric content moves from the stomach through the esophagus into the larynx, into the area of the voice box. And the symptom is basically those of respiratory and voice symptoms or voice abnormality, respiratory or voice related abnormality. Another typical gastroesophageal reflux disease or reflux disease from the stomach is gastrootitic or gastrotympanic. By gastrootitic or gastrotympanic, I mean reflux of gastric content into the middle ear through the eustachian tube. So we can have gastric content moving from the stomach into the esophagus, passing through the pharynx into the middle ear through the eustachian tube. This we call gastrootitic or gastrotympanic. By extension, gastric content can actually move from the stomach into the esophagus to the pharynx to the nose through the nasopharynx, and then by extension to the sinuses. And you have gastrosinus or gastronasal reflux. And the symptoms will also be in keeping with both nasal and sinonasal symptoms, as the case may be. So it's very important to know or have information with respect to this gastroesophageal reflux is to be able to have high index of suspicion when you have patients presenting with this, because it's a very common condition in our environment, but a lot of people are not just aware of this. We can have it pathological, which is what we've talked about, but there are physiological gastroesophageal reflux. This is found in neonates. We know the muscles, the muscle tone, and the tissues in neonates are still developing. So neonates can also experience gastroesophageal reflux disease, which occurs while feeding or just after feeding. And they may have gastric content reflux back into the pharynx, either to the nose, the ear, the larynx, into the airway, and then you have so many symptoms in keeping with this reflux in neonates. So it's important to know that gastroesophageal reflux can be pathological and it can also be physiological. So for the physiologic type, it occurs in neonates. Very, very important. Secondary gastroesophageal reflux are those refluxes occurring due to certain underlying condition, commoner in children, like a child with tracheoesophageal fistula or a child with neuromuscular disease. Such a child may experience gastroesophageal reflux disease. The frequency of symptoms varies depending on the patient. We have situations whereby about 5 to 10% of the population may actually experience daily reflux symptoms, and up to 40% may experience reflux symptoms monthly. I mean 40% of the population experience reflux symptoms every month, at least once a month, while 5 to 10% of the general population experience reflux symptoms at least every day. The medical opinion is sought in about 75% of cases. About 75% of cases, medical opinion is sought, which is very important. It's of major concern to people. So about 75% of the population will seek medical advice. Some of them may be adults, some in children presenting with gastroesophageal reflux disease, as the case may be. So importantly is that gastroesophageal reflux disease is not as rare as we think it is. In fact, it's very common, not just in adults, but in children. A lot of children come down with gastroesophageal reflux disease. Less than 5% actually are referred for surgery. Complications are complications are rare. In some cases, stricture, and in some cases, Barrett esophagus, and very rare. Barrett occurs in less than 1%, while stricture occurs in about 2%. So at least one episode of reflux per day can occur at 4 months, where you have 67% of infants coming down with at least one episode of reflux every day. About at 1 year, 5% of infants can come down with gastroesophageal reflux disease, while 3 to 9 years, about 2% can come down with gastroesophageal reflux disease. Significant proportion of these children will actually have gastroesophageal reflux disease as adults, and that is very, very worrisome, That means some children can actually grow to have gastroesophageal reflux disease. From childhood, they may grow into adult and then continue to have gastroesophageal reflux disease. Very, very